Hi everybody, my name is Alexis and my demonstration today is going to be on how to pack a hospital bag. So with COVID-19, things look very different just all around. Going to the grocery store is way more difficult. Just doing the simplest task is just harder. Getting the simplest supplies is harder. And that's also the case in a hospital. I have been a unit clerk at the James for almost 2 years now. And things that were just super simple, just one phone call away, are now a very long, timely process. We are understaffed, so I'm already stretched thin. And just getting simple materials for some of our patients has become way more difficult. And so today I'm just going to explain to you guys a few things to make sure to grab, whether it's for you going to the hospital or something happens with like family. Obviously, if it's an emergency situation, you're not going to be walking in circles trying to find some sweatpants or something. But if you do have a few minutes, it'll make it way easier for you. It'll expedite the process of you getting or them getting admitted, whatever the situation is. First thing I always recommend to people to make sure that you actually have like a physical like duffel bag or something to put things in. Don't bring things in a trash bag or anything. That's just a recipe for disaster and getting people upset, and that's just all around a bad idea. Even just bringing things in like a grocery bag makes it way easier, where we can at least identify that that's not just garbage. So if a couple like the first tier emergency supplies and stuff that are first tier, like more important things you're gonna want is make sure you bring any like home medications with you, if possible. To, like grab the bottles out of the medicine case. Bring like I always keep my insurance cards in my wallets, whatever your situation is. Just grab insurance cards. Make sure you have your identification. Primary care physician information so that they can get your previous medical records to them to help expedite the process of getting you admitted, getting you out of the situation of being in an overrun emergency room. Because places like that, they're not going to be as well sanitized because there's such a quick patient turnaround, and just people coming in with straight up COVID, you're not going to want to just sit around down there. So also a couple like secondary tier things. If you have a few more minutes to grab stuff, phone charger is a huge deal for people. Please, please, please bring one if you can. Because like having a phone with visitor restrictions and everything, it's very important to keep people up to date, keep them aware that you're okay, not inducing panic, not overwhelming the nurse's station or me with phone calls in regards to how somebody's doing. It's just keeps things simple. Before, I was able to just like send a phone call and get a phone charger brought right up. Now, like if it's the weekends, you're guaranteed you're not going to get a phone charger. During the week, if volunteer services happens to be there, you may get lucky and they'll have one. But with like limited funding and everything, we don't just have patient comfort items sitting around right now, unfortunately. It makes it just more difficult and keeps people get very cranky without phone chargers. Also, with like if you have glasses or dentures, making sure you bring like the items you need to bring with that. You don't want it to be like 7 a.m. and then waking up to eat breakfast and realizing they don't have their teeth in, because that is a very unwelcome surprise for them. Make sure you've got like glasses cases, things like that, just because we don't really have those on the floor. It's just another one of those comfort items, and it would be so much simpler if you brought it with you. They're easy to disinfect, to make sure that you keep all the germs and all bad stuff off. Also, just grabbing like a pair of sweatpants or something, just having some comfort items. If it's like your happens to be like a grandparent and they have Alzheimer's or something, and having a family picture with them would help them remember, because you're not going to be able to have a family member there with them. Just think of things like that you can just throw into a bag. If you're like overfilling a bag to go to the emergency room, you've overdone it. You don't need all that. Just to help keep people happy. It makes things so much faster. It expedites processes. If you have like all of your information, whenever you get here, you're ready, prepared, all the good stuff, you'll be much more satisfied. It just all around will provide a better experience if you bring in these essentials. All right, thanks.